This program is being recorded.
Good morning, everyone. We are live now. I'd like to welcome all parents, kids, and our fellow doctors to the January 10th, 2021 virtual Walk with the Doc Kids Time Nevada chapter of the American Academy of Pediatrics, or the AAP. My name is Dr. Lily Hadaji. I'm a pediatrician here in Las Vegas and co-owner of Oasis Pediatrics. I'm also the Walk with the Doc coordinator for the Nevada AAP. Our chapter has been meeting now for almost 5 years, every second Sunday of the month in Las Vegas. We coordinate kid-friendly talks on a variety of pediatric health topics and then enjoy an outdoor walk together. It's a really great way to get outdoors, learn important facts for our kids, and ask a pediatrician any questions we may have. The Nevada chapter also helps coordinate this event for the Reno community. Most of the year in Vegas, we typically join at the beautiful Springs Preserves outdoor venue. In the hotter months, between June and September, we typically meet up at the scenic Mount Charleston Visitor Gateway to escape the heat of the valley. So since we're all trying to keep our distance, protect ourselves, protect our community amidst this current pandemic, we will be holding our 10th virtual Walk with the Doc this morning, live streamed online. Today we are welcoming Dr. Terence McAllister, who is a pediatrician at Desert Valley Pediatrics here in Las Vegas. Dr. McAllister is also the incoming secretary and treasurer for the Nevada chapter of the AAP. As Dr. McAllister speaks, I encourage everyone to use the chat box to talk with each other and ask any questions that Dr. McAllister will be able to answer at the end of his kid-friendly talk. Dr. McAllister, we are ready when you are.
Great, thank you very much for the introduction. It's a pleasure to be speaking here today. My talk is a little bit different today than what I typically do. I've done these talks in the past, either virtual or in person, and I tend to do them outside and kind of off the top of my head. But the topic today is a little bit different, and we're talking about Project Firstline, which is a CDC project. And so I'm going to use some of the slides that they have created for us just to make sure that I'm sharing all the correct information. So let me get my screen up there. All right, and these are more or less just kind of a cue for me so I remember and cover all the big topics. So Project Firstline is actually something that's been instituted by the CDC in association with a number of different partners in order to encourage infection control among medical professionals. And although the project is designed towards medical professionals, a lot of what they have to say applies to a lot of other people as well. We're really talking about very simple things that we can do to help prevent infections in general, and of course, COVID-19 specifically. And although these are things that apply to medical professionals, to doctors' offices and hospitals, a lot of it really applies to wherever else you may be working or to life at home as well. A lot of these ideas are applicable just about everywhere. I think the CDC is reaching out to doctors and to medical professionals because although this is all stuff that we should know and that we have been taught, it's easy to fall into bad habits and to forget some of these really simple things that make a big difference. And personally, I've always found that the best way for me to learn something is to teach something. So that's why I'm doing the talk on this topic today, really to help reinforce these topics or these issues for myself. So what we want to talk about is to understand how COVID-19 is transmitted. You have to understand how this illness is getting spread in order to be able to understand how to stop it. And that's what we're all trying to do. And so by understanding how COVID-19 is transmitted, that's going to help us to understand the rationale or the reasoning for the infection control practices for COVID-19 that I'm going to talk about today. I went too far there. All right. Let me fix this. Again, I apologize for doing something new here. All right, so Project Firstline is CDC's national healthcare Workforce Infection Prevention and Control Training Collaborative. And as it says on the slide, it aims to provide a foundational and practical knowledge directly to frontline healthcare workers and targeted components of the public workforce. So what that all means is that these are designed, as I said, to go towards healthcare workers and to anybody else who may be coming in contact with this infection, which is really everybody at this point. And so these same principles can be applied at any workplace and by families at home as well. So with COVID-19, it's important to understand how it spread. And the reason why this infection has spread so fast and it's so widespread and so hard to control is because it can be spread by both people who are pre-symptomatic and even people who are completely asymptomatic. And so I'm going to explain what those words mean. Pre-symptomatic means that you've been exposed to the virus and your body is starting to get sick from it, but you don't feel sick yet. And so for a few days before you even know that you have this virus, you are getting sick from it and you are able to spread it to other people. And you don't realize that until a few days later when you start to get symptoms. And then there are people who are completely asymptomatic, which means they have no symptoms from COVID the entire course of the illness. So these people will never know they were sick from it, but they are still able to transmit it, to spread it to other people who can get sick from it. This is why when we do testing, we do something called contact tracing. So somebody who's tested positive for the illness, healthcare workers or public health workers try to help that person reach out to other people they may have been in contact with for several days before they started feeling symptoms, because those are the people who are at risk for having caught this illness from them. And then COVID-19 spreads mainly from person to person through respiratory secretions. And respiratory secretions are those fluids that come out of your mouth when you cough, sneeze, talk, or sing, or laugh. All of those generate respiratory secretions. These are generally invisible, but you can prove to yourself that it's happening. In days when it's cold, you can sometimes go outside, and if you breathe out, you can see that steam in front of your mouth. Or even if you go inside and if you breathe on a mirror, you'll see the mirror steam up. And those are respiratory secretions. And those are always coming out of your mouth all the time. If you have COVID-19, even if you're pre-symptomatic or asymptomatic, the virus is in those respiratory secretions and it comes out from the person who's infected and they can land on other people and get in through their eyes, the nose, or the mouth of people nearby and get inhaled directly into the lungs as well. So since the virus is spread through these respiratory secretions, one of the recommendations that is made to medical professionals is to optimize indoor air quality and minimize proximity to others. So we know COVID-19, since it's spread through these respiratory secretions, is more likely to spread in environments where people are close together in spaces that are poorly ventilated. Okay, this is why the recommendations have been made to close indoor dining and why the recommendations say that dining outdoors is safer than dining indoors. Although anytime you're close to somebody, even if you're outdoor, you're still close to somebody. But the places that are where individuals are closely together in spaces that are poorly ventilated. So again, this is why we have those restrictions on dining, restrictions on public gatherings, why the sizes of groups that can get together are limited. From the medical professional perspective, we also want to ensure that care processes do not require people to be close together, except when clinically necessary. So this means trying to keep people who are potentially sick separated from people who are potentially well. In my office, we do this by separating our well visits and our sick visits. So we see well children in the morning in my office and sick children in the afternoon to help keep people separated. We also have slowed down the number of patients per hour that the doctors are seeing. And we do this mainly to try to minimize people building up in our waiting room. If we're seeing a lot of people are getting behind, the people build up in our waiting room, and then those people are stuck together, close together in our waiting room, breathing each other's respiratory secretions. And the other thing that's recommended is to ensure that HVAC systems have been inspected and optimized. And what does that mean? Well, HVAC means heating, ventilation, and air conditioning systems. So medical facilities are recommended that they make sure that these are being maintained, that the filters are being replaced, and that the systems are working properly. This applies to home as well, especially in the wintertime. The furnace is on, the heat's on in most people's houses. Make sure that the filters in your house have been replaced appropriately and make sure that the air is being ventilated properly in your house. So then again, to put it from the healthcare perspective, we get back to triage and screening. So this is how we help to minimize from having lots of people close together whenever we can avoid it. And so these are instructions that are given to medical professionals to tell patients before bringing them in for care. And so I think it's important for everybody out there to understand these as well. So using telehealth options. When you can use telehealth options right now, that's a good thing to do. Especially right now, we've had talks in the past about how depression symptoms have been increasing among people during the pandemic, and stress is certainly higher. And so a lot of people are seeking out counseling, seeking out therapists. And a lot of that can be done by telehealth. You can talk to somebody over the computer screen to get that assistance from somebody without having that personal face-to-face contact. In my pediatric office, we do that quite a bit whenever we can. So a child who has a rash, I can see the rash over the camera on the computer just as easily, or almost as easily as I can in person. There certainly are some things that can't be done by telehealth that I need to see somebody in person. But if we limit those, and whenever we can do telehealth, we do, that helps to keep people separated. What to expect on arrival for in-person care. A lot of medical practices have changed this recently. At my office, when people show up, they're given a phone number to call when they get to the office. And by doing this, if the waiting room is crowded, we can recommend that people stay in their car for a little bit, but still check them in so that they'll still be seen when their appointment time is available. Or sometimes if we know somebody is sick, and that's why the next bullet point, there's requirement to report symptoms. If we know somebody is sick, or we know that they've been exposed to COVID, then sometimes we'll bring them into the back door. We'll keep them out of the waiting room entirely. We'll keep them out of our triage rooms. We minimize their exposure to other people in our office. And so it's important when you are making a medical appointment, talk to your office about possibly doing telehealth, talk to them about their check-in procedures, and follow through with those procedures to help keep you and everybody else safe. The other thing that's done at medical facilities is to provide supplies for respiratory hygiene and cough etiquette. So these are providing hand sanitizer stations, ways to throw away tissues without having to open up a trash can, because if you have to open up a trash can, the person before you also had to open it, and those germs can spread that way. A lot of hospitals are limiting points of entry into the facility. So most hospitals have several entrances and exits, but a lot of them you'll notice right now are closed. And that we want to have just one or two ways for people to get into our office so that we can know who's coming in and make sure that they've been screened properly. Preventing crowding of patients in shared areas. I mentioned this before, doing things like having people wait in their car or limiting the number of appointments that we have. All those go to help prevent the crowding of patients. And then screening patients, visitors, and staff on arrival for symptoms consistent with COVID-19. And so this is certainly important. A lot of hospitals and most doctors' offices will take your temperature when you come into the office right now, which is important because somebody who's currently symptomatic can certainly be contagious. However, as we spoke earlier, people who are asymptomatic or pre-symptomatic can also be contagious. So screening for people who have symptoms is helpful, but it's not enough because there certainly are people who don't have symptoms who can be spreading this illness. Source control. So source control is a fancy word for saying the source is the person who's currently sick with COVID. And so controlling the spread from somebody who is currently sick to other people. So source control should be practiced by everyone at the healthcare facility. So if we know somebody or suspect somebody who's sick, we don't want them spreading the infection. And this can apply to everybody. And the main form of source control, other than limiting exposure to other people, is a mask. A mask is so important. So wearing a mask to cover your nose and mouth at any time when you might be near other people. So in the hospital, this includes when I'm seeing patients, but also in non-patient care areas. So break rooms, passing people in the hallway, things like that. It's important to have the mask all the time. And even outside the healthcare facility for the general public, wearing a mask anytime when you might come in contact with somebody who's not in your immediate household is important. So every time you leave the door to the house, you should put on your mask. The recommendation in healthcare facilities is that cloth masks are perfectly appropriate for patients and visitors to be wearing, but healthcare personnel should wear surgical masks, which are those blue paper masks that everybody at this point is probably familiar with. The reason why those are a little bit better is that those masks are all pleated. They have folds in them, which have the effect of creating multiple layers of the material that the respiratory secretions have to pass through. And also the material that the surgical masks are made out of have a slight electrostatic charge in them. And so they have some advantage in actually binding to the virus particles and preventing the spread through them. So those surgical masks are a little bit better than cloth masks, although cloth masks that have multiple layers or that have a lining in them are also very efficient. And then there are further recommendations in the healthcare facility for using respirators, N95 masks when we're taking care of people known or suspected to have COVID, because those people who are currently symptomatic are the most contagious. Hand hygiene. I think this is the most important thing for everybody to take away from this talk, is that washing your hands are so important. So hand hygiene, which either washing with soap and water or using an alcohol-based hand sanitizer, is critical. So these respiratory secretions that come out of our mouth often get on our hands. People, if you're coughing, you're going to cover your mouth with your hand. We recommend covering with your elbow, but a lot of people don't do that. And sometimes just by habit, you bring your hand up to your mouth. And it happens all the time. If you watch people are constantly touching their face, and it's a hard habit to break. And so hand hygiene in the medical profession, that means before every time you see a patient, after every time you see a patient, before any time you put on gloves, after every time you take off gloves, and anytime you come into contact with surfaces in a patient's room. So that's a lot of hand hygiene, but it's very important. And it's very important to help limit the spread. The virus that causes COVID-19 is inactivated by detergents like soap and water. So just washing with soap and water works, but the alcohol and the alcohol-based hand sanitizers is also equally and possibly even more effective at killing the COVID-19 virus. So in closing, the thing to remember right now is that we are moving into the colder months, into flu and cold season, which means people are indoors more. It's harder to ventilate. It's harder to, you don't have the windows open. People aren't gathering outside as much. And so this is the time of year when we typically see most viruses passing more aggressively from person to person. So rigorous infection control is critical for protecting our healthcare workforce, as well as everybody else that's out there. The rigorous infection control in the healthcare field, as well as everywhere else, is going to be what's important for us to finally stop the spread of this virus, and to have things get a chance to getting back to normal. All right, and those are all my slides. So Dr. Hadaji, did we have any questions?
Yes, our first question is, where can I find the Project Firstline videos, and are they really kid-friendly?
Yeah, so Project Firstline, as I said, is designed by the CDC for healthcare providers, but the material that they have actually is very accessible to everybody, including the kids. So they present a lot of the information in a very kid-friendly, a very simple way. There is a Project Firstline website, but actually the best place to get their information is from their Facebook page. They have a number of great videos. The videos are 4 to 6 minutes each. They cover topics as simple as what is a virus, as well as ways to prevent the spread of the virus. And so that probably is the best place to go, is probably their Facebook page. All their videos are there in this. So they're easy to find, and yet absolutely they are kid-friendly.
Great, thank you. Our second question from the audience is, my 4-year-old cries when I try to put on a mask. What do you recommend we do?
Yeah, so that's a great question, because it can be very difficult for younger kids or for kids who have sensory issues. It certainly can be difficult to convince them to put on the mask. So there's a few things that you can and should do to help them with it, because the recommendation is that any child older than the age of 2 should be wearing a mask. Probably the best thing is practicing it at home. If it's only something you do when you leave the home, they're not used to it, so they're less likely to do it. If you're having them wear the mask at home as well, when it's safe for them to take it on and off, they can more over time get used to it. You can help them. There are so many masks available right now. When this all started, getting a mask was difficult. Now it's not. And the masks, Disney makes great masks. And so you can get masks with different characters on it, which can appeal to kids, to have them pick out a mask with somebody or something on it that they like to wear. You can also help them. What helps some littler kids is putting a mask on their stuffed animals. So if they put a mask on their stuffed teddy bear, then that helps to kind of more normalize it as well. So I think all those things can help, but really I think the best thing that they see their parents wearing the mask, that they have time to practice wearing the mask at home, so it's not just something that happens when you go outside. And I think over time that'll help kids to get used to it.
Great, those are great tips. Our next question is, my 12-year-old daughter says the soap from washing her hands dries her skin too much. Is using hand sanitizer okay instead?
Yeah, that's a great question, and she's absolutely right. Washing your hands frequently with soap and water absolutely does dry your hands out. And so you can help that by, using lotion after washing your hands. That can help. However, the hand sanitizer, yes, absolutely is equally effective. And actually, a lot of studies show it's more effective than soap and water at killing the COVID virus. So if you wash your hands, you want to wash your hands for at least 20 seconds, getting all the surfaces. If you use hand sanitizer, you want to rub your hands together until the hand sanitizer is dry. And that should take at least 15 to 20 seconds. If your hands get dry before that, it means you didn't use enough. The other thing with hand hygiene for kids as well as for adults is that certain places often get missed. And what often gets missed is the back of your thumbs, in your fingertips, and your fingernails. So make sure that you're concentrating on those areas as well when you're either washing your hands or using hand sanitizer, to make sure the entire surface of your hand is getting covered, washing them for at least 20 seconds if you're using soap and water. And if you're using hand sanitizer, until the hand sanitizer is all dried, which should take at least 15 to 20 seconds.
Okay, great. Thank you. Our last question, Dr. McAllister, is my 5-year-old hasn't been to the doctor for over a year. She's healthy and not going to school in person due to the pandemic. Does she really need a wellness check?
Yeah, so that's a great question. And yes, she does. So the wellness checks that we do address a number of different aspects of a child's health. So they do, at the younger ages, vaccinations are a very important part of those health visits. And for older kids, when they're not getting those vaccines at every visit, it's still important. We check kids' growth and development to make sure that they're gaining weight appropriately and not gaining too much weight, that they're getting taller as they should. But we also check in with their mental health. We check in with their developmental health. So there's a lot of different things that we look at in kids at those well checks. So yeah, I think they're very important. If you have a lot of reservations, you can always talk to your doctor's office. Some of those well visits can perhaps be done by telemedicine. That's a little bit trickier because we may miss subtle things that we'd otherwise find on an exam, but a lot of that other screening can be done by telemedicine, although not all of it. So it's kind of a stopgap measure, but it's better than not bringing them in at all. But yeah, I would have you call your pediatrician, talk to their office, find out what they're doing to control the spread of the virus within their office, find out what they're doing to keep your kids safe, and make that appointment for them, because I think it is important.
Okay, great. Thank you so much, Dr. McAllister, for that great talk.
You're welcome.
And thank you to everyone who joined us today for our virtual walk with a doc. So let's all go on a walk outdoors now. We'll stop the live feed, and I encourage all of you to take the time to enjoy some physical activity outside. It'd be great to see any photos of yourselves that you guys can post on the Nevada AAP Twitter feed, which is at AAP Nevada. Remember to walk for at least 20 minutes, bring your water, your sunscreen, maintain your social distancing, and of course, wear a mask. Our next virtual walk will be February 14th at 10 a.m. and we hope to see all of you then. Stay safe and stay healthy and have a great walk, everyone. Thank you again.